This is the video to demonstrate the Swedish massage techniques. The first thing that we've done is verify absence of contraindications for this. We've inquired about previous treatments and how she responded, or checked the patient charts. I've obtained towels and lubricant as needed. We're going to use grapeseed oil today, and I've washed my hands with warm soap and water. And we'll modestly expose the body part to be treated. So we're going to treat a low back area today. So I want to make sure that we use plenty of towels. And the patient then feels comfortable as far as where we're going to be treating. They can know the area that we'll stay in. So we're going to apply the lubricant as we start our first stroke, which is effleurage. And the stroke should be in this order. So effleurage starts distal, moves towards the heart in long, slow strokes. And your first effleurage strokes could be softer, not as deep, and then you just work into a deeper effleurage. Okay. After doing those for a couple minutes, we'll move on to the petrissage. Petrissage is where you take a group of muscles and you work them like you're kneading dough. So you're going to stay in the paraspinals for a little while, and then you could move on to the paraspinals on the opposite side. Okay. You might choose to work up into the quadratus lumborum for a while, in that area or in this area, but it's just taking larger muscle groups, concentrating on them, getting them to loosen up. So after petrissage, we could move into some tapotement techniques, and there's several listed for this. So we'll start with a few that in the order. The ulnar hacking, it's the ulnar side of your hand, going up and down the paraspinals. We have pounding, so we make a fist with a similar motion. Slapping. Tapping, just really light. I think that those are the main ones we have listed in the your skills checklist. Then you could do some vibration movements where you take just an area of skin and do some vibration. And then once we've done the tapotement and vibration techniques, then we're going to work back out and go back to the petrissage. It's the kneading strokes like this. And after we've done that for a few minutes, then we'll go into the effleurage. And again, we're back to those big, long strokes, starting with a deep effleurage. And moving into a light effleurage. And the effleurage strokes in at the end should take 2 to 3 minutes, and then your last one should be very light. After you get done, wipe off any excess lubricant used, check the patient, see how she's doing, clean up your area, and document your treatment.